A lot of progress has been made in gastric cancer and development, gastroesophageal adenocarcinoma in the past decade. After many negative studies, we've been able to make some breakthroughs, and the purpose of this Lancet review is to really focus us on what we've done, things that we have done well and things that maybe did not go so well. So things that we've done very well were biomarker-selected population for HER2 positive. Certainly, Keynote 811 transformed the field with pembrolizumab, trastuzumab combination in first-line setting, using tumor targeting together with anti-PD-1 therapy, with chemotherapy. We've done very well with checkpoint inhibitors in general in first line, again, transforming the field and helping people live longer, even in non-selected biomarker patients. And then the claudin inhibitors. Those are the three main themes in targeted therapy. And we talk about how to prioritize these therapies, and we talk about that microsatellite instability should be the first biomarker, and HER2 is the second, PD-L1 is the third, and claudin is the fourth, in that order in terms of targetability and clinical relevance. And the good news is the first three all get immunotherapy. And then claudin inhibitors are entering the market, and because they don't cause tumor shrinkage and response, but improve survival, I think it's an important biomarker for patients who are non-MSI, non-HER2, and maybe PD-L1 low or negative. We also talk about the lack of success with VEGF inhibition, and that's disappointing, but something that's important for us to consider, because there's been so many negative VEGF studies using bevacizumab, first-line ramucirumab, and now at ASCO, you will see the negative results of LEAP-15, which is combination of immunotherapy with lenvatinib, which is a tyrosine kinase inhibitor targeting VEGFR2. And then in general, the thrust of the review paper is to give you a primer of what's important in the biology of this disease. And of course, chromosomal instability is the key driver of this immune resistant state that we're dealing with. And also over time, the chromosomal instability becomes worse. So it's not a light read, but it's a comprehensive review. So I hope you enjoy it.